Hello everyone, this is Mrs. White, and for this brief video, we're going to be talking about the parathyroid disorders. Now, I feel I may have been better off to put these with thyroid dysfunction because the parathyroids do sit right on the thyroid glands, but for sake of being thorough, we will give them their own little video. As always, we will be doing next gen, analyzing and recognizing our cues, which is assessing the patient, assessing patterns, reviewing chart, considering their patient and their values, relevant from irrelevant information, trying to pick that apart, information in the past medical history that may be important. Analysis is more clinical, looking at the patterns, if we have enough data. Prioritizing hypothesis, these would be the possibilities, priorities, risks related to the solution, and risks if we don't do anything. Generating solutions, which is the patient goals, and action, taking action, which includes evaluation, would be implementing our plan, our skills, procedures, collaboration, teaching, ethical concerns, as well as any medications that we may do. But for this, we always will separate out our medications to help us remember them because we are all still in nursing school. All right, so parathyroid disorders. The thing I want to make very clear here with the parathyroid is that basically we're talking about calcium. Because of the parathyroid and the role in the calcium levels in the body, if we have too much parathyroid hormone, then we end up with too much calcium, which has an inverse relationship with our phosphate, versus if we don't have enough parathyroid hormone, or parathormone, sometimes it's called, we end up with decreased calcium. So we'll spend most of our time talking about hyperparathyroidism because hypo is it's a pretty interesting thing. It usually occurs mostly if we injure the parathyroids or take them out as part of a thyroidectomy, and at which case you'll have the findings of hypocalcemia and will need to replace their calcium. So let's talk about hyperparathyroidism a little bit more in depth. Basically, it's increased secretion of parathormone or parathyroid hormone. And basically, the parathyroid hormone, it has a big role, right? It helps us basically put the calcium back into our bones, helps the kidneys, tells the kidneys to reabsorb the calcium, activates vitamin D. So if we have too much parathyroid hormone, then we often have too much calcium. And too much calcium can be absolutely dangerous. We found out that hypercalcemia needs to be treated, and there are different ways that we can treat it. So there's a few different causes of hyperparathyroidism. They can be primary, secondary, or tertiary. So primary, and one of the more common reasons, is an adenoma, so a head and neck cancer, or it could just be benign. Secondary would be if the person doesn't have enough vitamin D, they have chronic kidney disease, or their phosphate level is increased because of that feedback loop that exists in the body. And then tertiary is the loss of the negative feedback control. So this happens to folks who've had like kidney transplant after being on dialysis for some time. So that's what we're going to look for. All right, so what are some of the signs and symptoms? Person could have no signs and symptoms at all, right? Could be just picked up on routine lab work, or they would have symptoms of hypercalcemia. So remember, calcium acts as a sedative in the body, so the person is tired, constipated, muscle weakness, especially in the lower extremities. Person could have signs and symptoms of osteoporosis. They could have renal failure, stones, right? Calcium can cause renal stones. Too much calcium can cause cardiac changes, so they might have arrhythmias and cardiac dysrhythmias, and they could end up with fractures, right? paresthesia. Person may end up with muscle atrophy. The cardiac complications can lead them to having angina. All right, so relevant diagnostics. If somebody has hypercalcemia, it's standard that we should be checking their parathyroid hormone level. The urine would often show increased calcium for hyperparathyroidism, right? Because the body's excreting it has too much. A serum calcium greater than 10. Their phosphate less than 3. They might show changes in their alkaline phosphatase, which would lead us to believe they have bone disease. We might do a DEXA scan. But again, the biggest thing that's going to tell us that a person has a parathyroid disorder is the parathyroid hormone level. So under generating solutions and take actions, whether the person has too much parathyroid or too little parathyroid hormone, the goal is the same. We want their calcium to be maintained within normal limits. So again, talking more about hyperparathyroidism, my golden rule, if we have too much, thin it out, right? So we often will need to increase fluids, give them IV fluids. We want the patients to be moving and doing weight-bearing exercises because that actually helps calcium go into the bones. For primary and secondary hyperparathyroidism, we can offer surgery. So we might have partial or total removal of the glands. But then think about what happens. We remove the parathyroid and the calcium, which was high, will now be low, correct, if you said low. And if that's the case, then we might need to actually replete their calcium. And then for post-op care of a person with a parathyroid disorder, I want you to go ahead and watch the thyroid video and look at the post-op care of the thyroidectomy patient because the parathyroid glands are right on the thyroid, so it's exactly the same care, basically. All right, so medications to know, calcium, and how we give calcium and why we give calcium. You'll see calcium given a lot in nursing. We give calcium even when people have hyperkalemia because remember it acts as a sedative. It's going to calm that heart down. So if we don't have enough calcium, we need to add it. If we have too much calcium, we can give biphosphonates because those push the calcium back into the bone. IV fluids to thin out the calcium. Loop diuretics. Loop diuretics can actually increase urinary excretion of calcium. So they do have a role. And then cinacalcet, that's for secondary hyperparathyroidism, those with chronic kidney disease. So that being said, that's really all I have to add about parathyroid disorders, and thank you so much.